Welcome to the YouTube's endless sea of medical nonsense. You're here because you want to know about lupus, a disease that's confusing, frustrating, and downright tricky. This isn't a magic pill or a quick fix. I'm not going to save your life in the next 10 minutes. What I will do is give you the real story, the science, the symptoms, the treatments, and the ugly truths nobody else wants to talk about. If you want fairy tales, go elsewhere. But if you want to understand lupus like a doctor who's seen it all, stick around. Because knowledge might not cure you, but it's the first step to getting the right help. And that's what really matters. So, you think you know lupus? Think again. Lupus is the medical equivalent of that annoying riddle you can't solve, the disease that makes doctors sweat and patients miserable. It's the "it's never lupus" joke that somehow always ends up being lupus. Why? Because lupus is a shapeshifter, a liar, and the ultimate drama queen of autoimmune diseases. It can look like arthritis, infection, cancer, or even a mental breakdown. It can attack your skin, your joints, your kidneys, your brain, basically anywhere it wants. And it loves to mess with your head. If you want a diagnosis that feels like playing Russian roulette with your patient's life, lupus is your game. Back in the Dark Ages, some medieval doctor looked at a patient's face and said, "Looks like a wolf bit you." Hence the name lupus, Latin for wolf. Because nothing says friendly like being named after a predator. For centuries, lupus was just a skin disease, those scaly, crusty rashes that made people look like they'd been in a fight with a wild animal. Then Sir William Osler, a guy who actually knew what he was doing, noticed it wasn't just skin deep. He saw joints swelling, kidneys failing, brains misfiring. Suddenly, lupus wasn't just a rash. It was a systemic nightmare. Fast forward to the 20th century, when some clever folks discovered autoantibodies, the immune system's version of friendly fire. They realized lupus wasn't an infection or cancer, but your own immune system turning against you. Welcome to autoimmune hell. No one knows exactly why lupus happens. If they did, I'd be out of a job. But here's what we do know. Genetics. You're more likely to get lupus if your family has a history of autoimmune diseases. Thanks, Mom and Dad. Environment. Sunlight is like gasoline on the lupus fire. Infections, smoking, certain drugs, and hormones, estrogen, also play their part. It's like your immune system is a paranoid soldier who's been pushed too far. Immune dysfunction. Somehow, your immune system forgets the difference between friend and foe. It starts attacking your own cells, producing autoantibodies that form immune complexes. These complexes get stuck in your tissues, causing inflammation and damage. It's like your immune system is throwing grenades in your own backyard. Imagine your immune system as a security team. In lupus, that team goes rogue. B cells start producing antibodies against your own DNA and proteins. T cells lose their way. Complement proteins, which should help clear debris, get used up in the chaos. Dead cells pile up because the cleanup crew is on strike. The immune system sees this debris as an enemy and attacks again, creating a vicious cycle. This immune mayhem leads to inflammation everywhere: skin, joints, kidneys, brain, you name it. Lupus is the ultimate impersonator. Here's what it likes to throw at you. Fatigue, the kind that makes getting out of bed feel like climbing Everest. Fever, low grade, mysterious, and annoying. Joints, painful, swollen, stiff, but unlike rheumatoid arthritis, no joint destruction. Yet, skin, the classic butterfly rash, a red, angry mask across the cheeks and nose. Discoid lesions that scar. Photosensitivity that makes sunlight your enemy. Kidneys. Lupus nephritis is the real deal killer. Protein in urine, swelling, high blood pressure, and if untreated, kidney failure. Heart and lungs. Pleuritis, pericarditis, and increased risk of heart attacks because lupus loves to mess with blood vessels. Blood. Anemia, low white cells, low platelets, your bone marrow's under attack. Nervous system, headaches, seizures, psychosis. Yes, lupus can make you crazy. Mouth ulcers, hair loss, Raynaud's phenomenon where fingers turning blue and white in the cold, lymph node swelling. Diagnosing lupus is like detective work in a fog. No single test will give it away. You need a combination of clinical clues and lab tests. ANA, anti-nuclear antibody. Positive in almost everyone with lupus, but also positive in healthy people. Not a smoking gun, just a hint. Anti-dsDNA and anti-SM antibodies. more specific, especially for lupus nephritis. Complement levels, usually low when lupus is active. Urinalysis, protein, blood, signs your kidneys are crying for help. Blood counts, watch for anemia, leukopenia, thrombocytopenia. Biopsy, kidney biopsy is the gold standard for lupus nephritis. Remember, lupus is a clinical diagnosis. If you wait for perfect lab results, your patient might be dead. There's no cure. You can only manage symptoms and try to keep the immune system from turning your body into a war zone. NSAIDs, for mild joint pain and fever. Like aspirin for a bullet wound, better than nothing. Hydroxychloroquine, the MVP. It calms the immune system, prevents flares, and improves survival. Plus, it's cheap. Steroids, powerful, fast-acting, but with a laundry list of side effects. Use the lowest dose possible, and don't get lazy. Immunosuppressants, azathioprine, methotrexate, mycophenolate, cyclophosphamide, the heavy artillery for serious organ involvement. Biologics, belimumab, and others target specific immune pathways. Expensive, but sometimes necessary. Lupus used to be a death sentence. Now, with modern medicine, most patients live decades after diagnosis. But it's a roller coaster, flares, remissions, and the constant threat of organ damage. Watch out for cardiovascular disease. Lupus patients get heart attacks younger and more often. Infection risk is high because of immunosuppressive drugs. Pregnancy is risky but manageable with good care. In short, lupus is a chronic, unpredictable, sometimes deadly disease that demands respect. We're not done yet. Scientists are hunting for better biomarkers to catch lupus early and predict flares. New drugs aim to be smarter, targeting only the bad immune cells without wiping out the good. Gene therapy, stem cells, precision medicine. The future might finally tame this beast.